Good day everyone. Today we will be discussing about the drug named Ibandronate. Ibandronate comes under the pharmacological category of biphosphonates. The action of ibandronate on bone tissue is based on its affinity for hydroxyapatite, which is part of the mineral matrix of bone. Ibandronate inhibits osteoclast activity and reduces bone resorption and turnover. In postmenopausal women, it reduces the elevated rate of bone turnover, leading to, on average, a net gain in bone mass. Ibandronate is indicated in the treatment and prevention of osteoporosis in postmenopausal women, bone metastasis and hypocalcemia in malignancy. The side effects observed during the administration of ibandronate includes upper respiratory infection, back pain, dyspepsia and bronchitis. Ibandronate is contraindicated in hypersensitivity, uncorrected hypocalcemia, or if the patient is unable to stand or sit upright for at least 60 minutes, or if the patient has esophagus abnormalities that delay emptying. The drug has to be taken on an empty stomach. Take with a full glass of water. Do not take this medication with other liquids. Juice or coffee can significantly reduce bioavailability. Avoid concomitant multivalent cation-containing drugs or food. Osteonecrosis of the jaw can occur spontaneously and is generally associated with tooth extraction and/or local infection with delayed healing. Known risk factors include invasive dental procedures like tooth extraction, dental implants, bony surgery, or diagnosis of cancer, concomitant therapies such as chemotherapy, corticosteroids, angiogenesis inhibitors, or poor oral hygiene, and comorbid disorders. Risk of osteonecrosis of the jaw may increase with duration of exposure to bisphosphonates. There is a possible increased risk for atypical subtrochanteric and diaphyseal femur fractures. Consider periodic re-evaluation of need for continued bisphosphonate therapy, particularly if treatment is greater than 5 years. Patients with new thigh or groin pain should be evaluated to rule out a femoral fracture. Serum calcium, vitamin D, and renal function require baseline monitoring before initiating bisphosphonates. In patients with calcium or vitamin D deficiency, the recommendation is to correct the deficiency before starting bisphosphonates. The clinician should take a detailed dental history before initiating bisphosphonates, and therapy initiation should delay if planning an invasive dental procedure in the near future. Bone mineral density shall be evaluated 1 to 2 years after initiating therapy and every 2 years or more frequently in patients deemed high risk. Thank you. Kindly comment for further queries and doubts.